Okay, so in this video we will be discussing about the ANDI, which is the aberration of normal development and involution. So what happens is that it's a concept which will help us to explain that many breast conditions are not true diseases. These are because of the variations and exaggeration of normal breast developments. So it's because of the variation and the exaggeration of the normal breast development. It could be because of hormonal changes or aging as well. So it has been defined into 3 phases, but the reason behind these would be because of the cyclical changes of estrogen and progesterone. And I've already mentioned that on terminal duct lobular unit, it is highly responsive to hormones. So it would be responsive to estrogen, progesterone, prolactin, and also growth hormone. So these all hormones act on the epithelial cells, also as well as on the stromal cells of the terminal duct lobular unit. When they act on these, what happens is that they act as growth factors. So these hormones will be acting as growth factors on the epithelial and the stromal cells of terminal duct lobular unit, which would lead to variations and exaggeration of the normal breast tissue. Now it can present as 4 forms, right? It would be in the form of cyst, it could be in the form of fibrosis, it could be in the form of hyperplasia, or it could be in the form of papillomas. We're going to be dividing ANDI into 3 phases. The first phase, second phase, and third phase. The first phase is the one in which it is said to be the developmental phase. It is basically the puberty to early adulthood phase. The second one would be the one in which cyclical changes are going to be found. So it is called as the reproductive phase. And the third one is the aging or the involution phase. This is the early puberty and puberty to early adulthood. This is going to be the major adulthood years of hormonal changes between 15 to 50 years, I guess. And then this is going to be between the 35 to 55 years. So if I'm going to be discussing the first one, that is the hyperplasia. Hyperplasia basically leads to more than one layer of cells in the duct and the lobule. So there are going to be 2 layers of cells in the duct and in the lobule. Now these cells could be typical in nature or atypical in nature. Atypical would be further defined into the ductal hyperplasia, so atypical ductal hyperplasia and atypical lobular hyperplasia. These could further lead on to cancers as well. So the second one is the papilloma. This is basically defined as the localized hyperplasia of ductal epithelium. So this is your duct and this is your lobule. It is going to be because of the local hyperplasia of the ductal epithelium. So it's going to be presenting like this. Now this has a fibrovascular core as well. These papillomas are further divided into 3 parts. Papilloma could be solitary in nature, or it could be more than one, which is also called as papillomatosis. So 5 or more, or it could be juvenile papillomatosis, which is called as what? Swiss cheese disease. So we've talked about papilloma, which is localized hyperplasia of the ductal epithelium. This could be solitary, means single papilloma being present. It could be papillomatosis where more than 5 are present, and it could be also juvenile papillomatosis, which is called as Swiss cheese disease, which affects young women who presents with multiple firm palpable nodules on the breast, and microscopically there are going to be multiple papillomas. So we have discussed about hyperplasia. As we've said, there would be cyst, fibrosis, hyperplasia, and papillomatosis or papilloma. So we've discussed papillomas, we've discussed hyperplasia of the duct or the lobule having more than one cell layer. Then we're going to be discussing about fibrosis. Fibrosis is basically when the fat and the elastic tissue of the breast is replaced by the fibrous tissue. It could be because of chronic inflammation as well. And for the cyst part, I'm going to be in the cyst, it's basically what? It is actually the narrowing of the ductules. It is what? It is narrowing of ductules. Why? Because of the involution of stroma. So the clinical features of all of these is going to be, when we're discussing ANDI, so which is aberration of normal development and involution, the clinical features are going to be breast pain, which increase starting from day 14th. So premenstrual days, it's going to be increasing from day 14 to 28, and it's going to get worse and severe. And second one would be the lumpiness. So the clinical features are going to be lumpiness of the breast, also breast pain. For the treatment purposes, you have to exclude malignancy by clinical examination, radiological support, which would be mammography and also ultrasound. Alongside with that, review the patient during different times of menstruation as well. So tissue diagnosis may be needed to relieve the anxiety of the patient that whether the lump is malignant or not. So it's basically the triple examination that is done. For the treatment of mastalgia, which is the breast pain, it is to first of all exclude cancer, then you reassure the patient, you provide them support, and then tamoxifen can be given, antidepressants can be also given, and danazol can also be given. So this is the ANDI for you guys.